Hello, everybody. My name is Lulu Achua. I am gonna be talking today about the skills on how to check the head, neck, and EENT. I do not have an actual patient with me or a stuffed animal, so I'm just gonna be explaining what I'm supposed to be doing on an actual patient. First off, I make sure I identify my patient with two forms of identification by asking the patient to please tell me their names and date of birth. While they do that, I cross check with their armband. I later on provide privacy for my patient and I carry out hand hygiene by washing my hands. I make sure I introduce myself to the patient so they know who I am and why I am there, telling them the procedures of what I am going to be doing. And I gather my supply or equipment that I needed for the skill. After this is done, I will ask the patient history questions. Any sorry. After this is done, I'm going to ask the patient some questions about if they've had about headaches, neck pains, vision problems, hearing loss, running nose, or if they are a smoker or had ever smoked. My assessment will start from the head and neck. I inspect the head for um, the general size and contour, and the hair color, texture, and distribution. I inspect the face for facial expressions and symmetry. I inspect the neck for symmetry, palpate the neck for to check for lumps, tenderness, and or deformities. I'm also going to palpate the temporal artery and compare them bilaterally. I palpate for position of the trachea, which is supposed to be in the midline, and I palpate and check the thyroid gland for swelling, and I will also check the eyes. In the eyes, I will ask the patients if they do wear glasses or contacts, and I inspect the internal eye structure and the general eye health. I check for the eyebrows if they are even. I check the eyelids and eyelashes. I check the conjunctiva and the sclera. I will also check the lacrimal apparatus. I am going to be inspecting the anterior eyeball. I am the entire eyeball structure. I will check the cornea and lens, check the iris, the pupils for the size, the shape, and making sure they are equal. And then later on, check the ocular fundus, sorry, and I check the red reflex. I'm going to be inspecting the general background of the eye. I will watch for the color and the integrity. I have to assess the pupillary light reflex. I have to shine the light in the left eye to see if the left pupils are constrict. Then later shine the light again and see if the right pupils, the right eye constricts at the same time. And then I repeat the procedure for the right eye. I will assess for accommodation. When assessing for accommodation, we'll start with the pen light about 18 inches in front of the nose and slowly bring it towards the patient and note if the pupils constrict. After the eyes, I'm going to be going with the ears. In the ear, I'll ask about hearing issues, hearing aids if they are using it, or um, they have it but they do not use it. I will also inspect the internal ear for the size of the ear, the shape of the auricle, the position and the alignment on head. Each ear, both ears are supposed to be on the same position, and the alignment is supposed to be um, equal on almost same position. And then I would note the skin condition, which is the color and the lesion. Also, I have to inspect the internal auditory meatus by noting the size, if there's any swelling, if there's any redness, discharge, cerumen, lesions, or foreign bodies. I palpate the following external ear structure for movement and tenderness. That is the auricle, which is the outer ear, the tragus, and the mastoid process. And I also perform otoscopic examination of the tympanic membrane for color and characteristics, positioning, and integrity of the membrane. And I'll perform the Rhine test, and also perform the Weber test, which will be done only if there is no audiometry. After the ears, I'm going to be moving straight to the nose. I inspect the nose for symmetry, deformity, and lesions. Inspect the internal nose with nasal speculum for color and integrity of the nasal mucosa. Sorry for not pronouncing that word right. Nasal mucosa. And I will check the septum for any deviation or bleeding. I will check the turbinate. And turbinate for the color. I also inspect with light for perforation of the septum. I palpate to test the potency of each nostrils. I'll palpate the sinuses, the frontal, and the maxillary, and that will be done with that. And then I move straight to the mouth and throat. In that, I will also ask the patient if they have any mouth pain, if they do wear dentures. I inspect the lips, the teeth, the gums, the tongue, the buccal mucosa. And I will also note that while I am inspecting all of that, I watch for the color, the integrity, and the lesion. And I'll inspect the hard and soft palate for color and integrity. And I'll make sure I also inspect and grade the tonsils. Either they are okay, or there is any deformity. I inspect the pharyngeal wall, noting the color, the exudate, and lesions, if any. I palpate under the tongue for lesions, palpate the tongue, and palpate the mouth as well for lesions. Then I'll complete the process by discussing my findings with the patient. After every procedure, the patient has the right to know what you saw and what the possible solutions to the problems or the issues that you identified in them. So when you discuss the findings with the patients, and that has to be in the best language that the patient will understand. I'll bring it down to the simplest form that the person can comprehend, and then it will not be completed without me documenting. So therefore, in the conclusion, I have to document all my findings, and making sure uh, the patient has understood. And even in my documentation, I will also explain there that I explain the procedures and my findings to the patient. Thank you.